Okay, let's dive right in. You're dreaming about early retirement. Finally, ditching the commute, having time for yourself.
A dream, yeah, freedom.
Absolutely. You've planned, you've saved, maybe even picked out a new fishing rod or, I don't know, gardening gloves.
Yeah, the fun part.
But then, boom, this massive question mark just hangs over everything. Health insurance.
Ah, yes.
Yeah.
The elephant in the room for so many people.
Exactly. How on earth do you manage health coverage if you retire before you hit that magic Medicare age of 65? It's scary for a lot of folks.
It really is. And it's not some niche problem either.
Yeah.
When we looked at the sources for this deep dive, the numbers are pretty stark. The median retirement age, 62.
62. So already before Medicare.
Right. And get this, 7 out of 10 retirees actually punch out before age 65.
Wow, 70%.
Yeah. So planning for healthcare in those gap years, it's not an edge case. It's the main event for most early retirees. It's a huge hurdle financially and just logistically.
It absolutely is. It can cause a ton of anxiety, and maybe rightly so if you haven't really mapped it out.
Mm-hmm.
So that's exactly why we're here today. We've dug through a bunch of sources, articles, guides, government FAQs, the whole shebang to really get into this.
Yep, a proper deep dive.
Our mission today is to unpack the main ways you can bridge that gap, that crucial period between leaving your job and hitting 65. We're going to focus primarily on the two big ones the sources talk about. COBRA.
Right, the continuation coverage.
And the ACA Marketplace, the Affordable Care Act exchanges.
Also called Obamacare sometimes.
Yeah.
Yeah.
We want to explore what they are, how they actually work, what they might cost you, and really help you think through which one might be the better fit for your situation based on what we found.
Exactly. We'll break down the key stuff, the pros, the cons, drawing right from the materials to give you, hopefully, some practical insights. This isn't just theory, right? It's about the actual steps you need to think about.
Mm-hmm. Totally. Okay, so let's set the stage a bit more. Why is this pre-Medicare period such a minefield? What actually happens when you walk away from that job?
Well, fundamentally, it boils down to how most Americans get their health insurance. The sources show almost half the country gets it through their job or maybe their spouse's job.
Tied to the workplace.
Exactly. And Medicare, the government plan, mainly for folks 65 plus, well, it doesn't start for most people until 65. So you leave that job early, you lose the employer plan.
Yes.
And suddenly, bam, you're on your own. You've got to find coverage in a totally different arena, the individual market.
Right. You step out of that big group safety net into buying it yourself. And figuring that out means understanding some basic insurance lingo. The sources all emphasize this, and it's key.
Oh, absolutely crucial. You'll see these terms everywhere. Think of them as the building blocks,
Perfect. Lay them on us. First up.
Premium. This one's pretty straightforward. It's the amount you pay regularly, usually every month, just to have the insurance plan. Your subscription fee, basically.
Got it. The monthly bill. Okay, what about when you actually need to, go to the doctor?
Okay. That's where the deductible comes in.
Yeah.
Your deductible is the amount of money you have to pay out of your own pocket for covered health care before your insurance really starts paying its share for most things.
So a hurdle you have to clear first.
Exactly. If your plan has, say, a $4,000 deductible, you'll generally pay the first $4,000 of your covered medical bills yourself that year. Then the insurance starts sharing the cost.
Okay, deductible first. Then I hear about copayment or copay.
Yep, a copay. That's a fixed dollar amount you pay for a specific service right when you get it. Like maybe $30 for a doctor visit or $100 for an emergency room trip.
A flat fee for certain services.
Right, and sometimes those apply even before you hit your deductible. Depends on the plan.
Okay. And coinsurance, that sounds different.
It is. Coinsurance isn't a fixed amount, it's a percentage. It's your share of the cost for a covered service after you've met your deductible.
Okay. So if it's 20% coinsurance and the bill is $100 after the deductible's met.
You pay $20 and the insurance company pays the other $80. Deductible first, then you share the costs through copays or coinsurance until you hit.
The big one. The out-of-pocket maximum.
Bingo. That's the absolute most you'll have to pay for covered services in a single plan year. This includes what you paid towards your deductible, your copays, your coinsurance. Once you hit that max number,
you're done paying for the year.
For covered services, yes. The plan pays 100% after that for the rest of the plan year. Knowing that number is super important for budgeting, especially for a worst-case scenario.
Okay, super helpful. Premium, monthly cost, deductible, what you pay first,
Yeah.
copay, coinsurance. Your share after that. Out-of-pocket max. your safety net limit.
Got it. So, looking at the big picture again, how do Americans get coverage?
Well, besides that huge chunk with employer coverage, about 49%, the sources show Medicare covers around 14–15%, Medicaid for low-income folks is about 21%, and then there's still about 8% uninsured.
And the group we're talking about, early retirees, they often land in that smaller slice, about 6% or so, who buy their own insurance directly on the individual market. That's where COBRA and the ACA Marketplace come in.
Perfect transition. Let's tackle option 1. COBRA. What exactly is it?
Okay, COBRA. It stands for the Consolidated Omnibus Budget Reconciliation Act.
Catchy name.
Yeah, typical government naming. But what it does is it's a federal law that gives certain folks the right to temporarily continue the exact same health plan they had through their job after they leave.
Temporarily continue the same plan. That sounds potentially really appealing.
It often is, especially at first glance. That's the big draw. You keep your doctors, your hospital network, your benefit structure. Even your progress towards the year's deductible usually stays the same.
Wow. Okay. So no disruption to care.
Generally, no. You even get the same choices during things like open enrollment if the employer plan has one. Continuity is the name of the game with COBRA.
That sounds great, especially if you really like your current doctors or you're in the middle of treatment. But who actually qualifies for this?
Right. Eligibility isn't automatic for everyone. Few key things. First, your old employer's plan has to be subject to COBRA. Generally, that means private companies with 20 or more employees or state and local governments.
So smaller companies might not offer it.
Typically not under federal COBRA, no. Federal government plans and church plans are also exempt, though some states have their own mini COBRA laws for smaller employers, so you'd have to check that.
Okay, so assuming the employer plan qualifies, then what?
Then you had to have been enrolled in that plan while you were working. Makes sense.
Sure.
And third, you have to lose that coverage because of what's called a qualifying event.
Qualifying event. For an early retiree, what does that usually mean?
The main ones are losing your job, whether you quit, got laid off, whatever, as long as it wasn't for, gross misconduct.
Okay.
Or if your hours got cut so much that you lost eligibility for the health plan. Those are the big ones for the employee.
Excess.
The sources also mention other events that can trigger COBRA for spouses or dependents, even if the employee's situation doesn't change things like death of the employee, divorce or legal separation, the employee becoming eligible for Medicare, or a kid aging off the plan.
Got it. So leaving the job is the main trigger for the retiree themselves. Now, the big question. How long does this temporary coverage last?
Typically, for job loss or reduction in hours, the standard maximum time you can keep COBRA is 18 months.
18 months. Okay, a year and a half. That might not be enough for someone retiring at, say, 60, right? They still have years until Medicare.
Exactly. 18 months is often just a bridge.
Yeah.
But there are specific situations where you might be able to extend it, sometimes up to 36 months total.
Okay, extensions. Let's talk about those. What are the possibilities?
The sources highlight two main ways to potentially get more time. First is a disability extension.
Okay.
If someone in the family covered by COBRA, could be you, your spouse, a dependent is determined to be disabled by the Social Security Administration or SSA. And that disability determination happens relatively early in the COBRA period, specifically within the first 60 days of starting COBRA.
That's a tight window.
It is. And the disability has to continue. If those conditions are met, you can potentially get an extra 11 months of COBRA coverage.
So 18 plus 11, that makes 29 months total.
Exactly. Potentially up to 29 months from the original job loss date. But critically, you have to notify the plan administrator about the SSA disability determination. There are specific deadlines for that notice. Usually you have at least 60 days after the SSA decision or after you're told about your notice duty.
Okay, so you have to be proactive about the disability notice. Does the cost change during that extra 11 months?
Yes. Good question. It can. During that 11-month extension period, months 19 through 29, the plan is allowed to charge you up to 150% of the plan's cost.
Whoa, 150%, not the 102%.
Nope. It can get significantly more expensive during that disability extension period. Something to definitely factor in.
Ouch. Okay, what's the other potential extension? You said 36 months was possible sometimes?
Right. That's through a second qualifying event extension. This can push the total coverage out to 36 months from the original qualifying event, like your retirement date.
How does that work?
It happens if a second separate qualifying event occurs during your initial 18-month COBRA period. And that second event is something that, on its own, would have caused the spouse or dependents to lose coverage under the plan if the first event, your retirement, hadn't already happened.
Okay, give me an example.
Sure. Say you retire, you're on COBRA. That's the first event. Then maybe 10 months later, you and your spouse get divorced. That's a second qualifying event for the spouse.
Ah, because divorce would normally mean the spouse loses coverage.
Exactly. So in that case, the spouse might then be eligible for COBRA coverage for up to 36 months total, measured from the date you originally retired.
Interesting. So it extends it for the person affected by the second event.
Correct. Other second events could be the death of the retired employee, the employee becoming entitled to Medicare during that first 18 months, or a dependent child losing eligibility. Again, just like the disability extension, you have to notify the plan administrator about this second qualifying event, usually within 60 days.
These extensions seem complicated, but definitely good to know they exist if you need that longer bridge. Okay, let's rip the Band-Aid off. The cost. Everyone says COBRA is pricey. Why?
Yeah, this is usually the biggest hurdle, the major sticker shock for early retirees. Under COBRA, you have to pay the entire premium yourself.
The whole thing, not just the part I used to see on my pay stub.
Nope. You pay what you paid, plus the chunk your employer was covering, plus the plan can tack on an extra 2% administrative fee.
So up to 102% of the total cost of the health plan for someone like me still working there.
Precisely. And since employers often subsidize a large portion of employee premiums, maybe 70 or 80% sometimes.
Your costs could easily double, triple, or even more compared to what you paid as an employee.
Easily. Same plan, same benefits, but the price tag you're responsible for just skyrockets. The sources are really clear. This cost is the #1 reason COBRA isn't a long-term solution for many people. And, like regular insurance, those COBRA premiums can go up each year too.
Yikes. Okay. So continuity is the big pro, massive cost is the big con. How do you actually, sign up for this thing if you decide to go for it? What's the timeline?
It all starts with notices. You should have gotten some general info about COBRA in your plan documents, like the summary plan description or SPD, when you first enrolled.
Okay, buried in the paperwork somewhere.
Probably, yeah. But then, when you actually have that qualifying event, like leaving your job, a specific notification process kicks in.
Who tells who?
Depends on the event. If it's your termination, reduction in hours, death, or you becoming entitled to Medicare, your employer has to notify the plan administrator. They've got 30 days to do that.
Okay, employer tells the plan for those big ones.
But if the event is divorce, legal separation, or a kid losing dependent status, then it's on you, the employee, or a family member, to notify the plan. You usually have at least 60 days after the event to give that notice.
Got it. So the plan gets notified one way or another. Then what happens?
Once the plan administrator gets that notice, they have 14 days to send out a COBRA election notice to everyone who's eligible in cost, you, your spouse, your dependents, who lost coverage.
And this election notice is the official, hey, you can sign up now letter.
Exactly. It explains your rights, the cost, and how to actually elect or choose to take the COBRA coverage.
Okay, so you get the notice. How long do you have to actually decide? Is it immediate?
No, you get a decent window. You have an election period of at least 60 days.
60 days to make up your mind. From when?
It's 60 days starting from the later of 2 dates. Either the date you received that election notice or the date your coverage actually ended or would end because of the qualifying event. Whichever date is later, your 60-day clock starts then.
Okay, so at least 2 months to weigh the options. If I have a family, can we choose differently? Like, can I take it, but my spouse doesn't?
Yes, absolutely.
Yeah.
Each person who qualifies, the employee, the spouse, each dependent child is considered a qualified beneficiary and can make their own independent choice about COBRA. One can take it, others can decline. Or, the employee or spouse can elect for the whole family too.
Flexibility there. Now, something the sources really emphasized was retroactive coverage. This sounds important.
It's huge EE. This is a major plus for COBRA. If you decide to elect COBRA within that 60-day window and you pay your first premium on time,
which we'll get to.
Right. If you do that, your COBRA coverage goes back in time. It's retroactive to the exact day your employer coverage ended.
So no gap, even if I take 50 days to decide.
Correct. No gap. If you need medical care during that 60-day decision period, before you've even officially signed up, you can still elect COBRA, pay the premium, and that care should be covered under the plan rules as if your coverage never stopped.
Wow, okay. That provides a real safety net during that decision period. That's actually pretty valuable.
It offers significant peace of mind, yeah. You don't have to rush the decision fearing an immediate coverage lapse.
Okay, so you elect within 60 days. When do you actually have to pay? Do you send a check with the form?
No, the plan can't demand payment right when you submit the election form. You elect first. Then you have 45 days from the date you make that election to pay your first premium.
Okay, elect within 60 days of notice loss, then pay within 45 days of electing. What about ongoing monthly payments?
Those are typically due monthly, just like regular premiums, and the plan has to give you a 30-day grace period for those subsequent monthly payments. If you pay within the grace period, you're okay.
Good to know about the grace period. What if? What if you initially say no thanks to COBRA, maybe thinking you'll get an ACA plan, but then change your mind within that first 60 days?
You can do that. You can initially waive COBRA coverage, but then revoke that waiver and elect it later, as long as you're still within that original 60-day election period.
But does it still go back retroactively then?
Generally, no. If you waive and then revoke the waiver later, your coverage typically starts on the date you revoke the waiver.
Yeah.
You usually lose that retroactivity benefit. The retroactivity really applies if you just take your time within the 60 days to make the initial election.
Gotcha. Okay, so COBRA starts. Can it end before that 18 or 36-month maximum period is up?
Yes, it definitely can. The most common reason is simply not paying your premiums, even after the grace period.
Makes sense. What else?
Other reasons include if your former employer completely stops offering any group health plan to any of its employees.
Yeah.
No plan, no COBRA.
Okay, company goes under or drops health benefits entirely.
Right. Also, if you, the beneficiary, enroll in another group health plan, like a new jobs plan or maybe a spouse's plan after you've already elected COBRA.
So you can't double dip.
Generally, no. Or if you become entitled to Medicare, usually by turning 65, after you elected COBRA, your COBRA can end then. And of course, they can terminate it for cause, like if you commit fraud related to the plan.
And if it ends early for one of these reasons, they have to tell you, right?
Yes, the plan has to send you an early termination notice explaining why and when it's ending.
That point about getting other group coverage is interesting. It means you can't just, keep COBRA as a backup if you get another job with insurance.
Correct. Electing other group coverage generally terminates COBRA eligibility. The transition between COBRA and other options needs careful timing.
Okay. And the sources briefly mentioned a few other niche things, like if the company goes bankrupt.
Yeah, if the company goes bankrupt and the health plan itself disappears, then COBRA coverage generally disappears too. There's also a mention of the health coverage tax credit, or HCTC, but that's for very specific situations involving trade adjustment assistance or pension benefit guarantees covering a chunk of premiums. Not broadly applicable. And they clarify FMLA leave protects your job coverage during leave. COBRA kicks in after if you don't return. Okay, so summing up COBRA. It's your same plan, provides continuity, can bridge gaps retroactively, which is great, but it's temporary, 18, 36 months max, and often really, really expensive because you pay the full cost plus a bit more.
That's a pretty good summary. Expensive continuity for a limited time.
Which brings us logically to the other major path the sources discuss, the ACA Marketplace.
Yes, the health insurance marketplace, set up by the Affordable Care Act, often called the ACA. This is basically the online place, think healthcare.gov, or your state's own version if they have one.
Like Covered California or NY State of Health.
Exactly. It's where individuals and families can shop for and buy health insurance plans if they don't have access to affordable job-based coverage or Medicare or Medicaid. It's the main hub for buying your own insurance now.
And who can actually use the marketplace? Is it just for certain people?
No, pretty much anyone living in the U.S. who's a citizen or lawfully present can use the marketplace to look for plans. Eligibility to enroll is generally open to anyone. The key constraints are when you can enroll. Okay, we'll get to the when. But a really huge point the sources stress about ACA plans is guaranteed issue. What does that mean, especially for an early retiree who might, have some health history?
This is absolutely fundamental, a cornerstone of the ACA. Guaranteed issue means that insurance companies selling plans on the marketplace cannot deny you coverage based on your health status.
Cannot deny you, even if you have diabetes or had cancer or have a heart condition?
Correct. They also cannot charge you a higher premium just because you have a pre-existing condition. ACA-compliant plans must accept you and cover your pre-existing conditions.
That is a massive difference from how things used to be in the individual market, right?
Night and day. Before the ACA, insurers could, and often did, deny coverage or charge exorbitant rates or exclude coverage for specific conditions. Some non-ACA plans, like short-term plans we might touch on later, can still do that, but ACA Marketplace plans offer that crucial protection.
That's huge peace of mind. Okay, so you can get covered. What kind of choices do you have on the marketplace? Is it just one standard plan?
Oh no, far from it. The marketplace offers a pretty wide variety of plans from different private insurance companies that participate in your area. These plans are usually grouped into categories called metal tiers.
Metal tiers, like metals.
Kind of. Bronze, silver, gold, and platinum. These tiers give you a rough idea of how you and the insurance company will share the costs throughout the year. It's not about the quality of care, just the cost sharing.
Okay, tell me about the tiers. Bronze versus platinum. What's the difference?
Think of it as a seesaw between your monthly premium and your costs when you actually get care. Bronze plans generally have the lowest monthly premiums, but they have a highest out-of-pocket cost, meaning high deductibles, higher copays, or coinsurance when you use services.
So cheap month to month, but could cost you a lot if you get sick.
Exactly. Good maybe for younger, healthier folks or those who want catastrophic coverage mainly. Platinum is the opposite end. Highest monthly premiums, but the lowest out-of-pocket costs when you need care. Lower deductibles, lower copays.
More expensive up front, but less painful financially if you need a lot of health care.
Right. And silver and gold plans fall in the middle of that spectrum, offering a balance between premiums and out-of-pocket costs.
So which tier is best? Is silver the average one?
The sources are really clear. There's no single best tier for everyone. It completely depends on your personal situation. How much health care do you think you'll use? How comfortable are you with potential high out-of-pocket costs versus paying a higher premium every month?
So you need to estimate your own needs.
Absolutely. Someone expecting few doctor visits might prefer a bronze plan's low premium. Someone managing chronic conditions might find a gold or platinum plan saves them money overall, even with the higher monthly cost. And importantly, silver plans have a special feature related to subsidies.
Ah, subsidies. Okay, let's talk about the money side of the marketplace, because unlike COBRA's pretty fixed high price, the ACA offers financial help, right?
Yes, this is a major potential advantage for early retirees. Many people qualify for premium tax credits, which are often just called subsidies. These credits directly lower the amount you have to pay for your monthly premium.
Lower my premium. How does that work? Who gets them?
Eligibility is based on your household income for the year you need coverage. Specifically, it's based on your estimated modified adjusted gross income, or MBGI, and your household size, compared to the federal poverty level, FPL.
MGI. Okay, I remember that from tax stuff. What goes into MGI for an early retiree usually?
Yeah, it's basically your adjusted gross income, AGI, from your tax return, with a few things added back in, like tax-exempt interest. For early retirees, common components are withdrawals from traditional IRAs or 401ks, any pension income, taxable investment earnings like dividends or interest, and importantly, capital gains from selling investments.
So money taken from pre-tax retirement accounts counts?
Yes, definitely. And the general rule is the lower your MAGI is relative to the poverty level for your family size, the larger the potential premium tax credit you could receive.
Makes sense. And the sources mention something really critical and timely about these subsidies right now.
Yes, this is hugely important for anyone planning retirement, especially around 2025 or 2026. Since 2021, we've had enhanced subsidies in place thanks to legislation like the American Rescue Plan and the Inflation Reduction Act.
Enhanced how? What did they do?
Two big things. First, they made the subsidies generally larger across the board, making coverage more affordable for more people. Second, and this was key, they removed the previous upper income limit for subsidy eligibility. Before, if your income was over 400% of the FPL, you got zero help.
Ah, the subsidy cliff.
Exactly. The enhanced subsidies got rid of that cliff, instead capping the amount anyone has to pay for a benchmark silver plan at no more than 8.5% of their MGI, regardless of how high their income was.
So even people with incomes moderately above that old 400% level could now get help.
Yes, it opened up subsidies to a whole new group of middle-income earners, including many early retirees.
There's always a however.
These enhanced subsidies are currently set to expire at the end of 2025, unless Congress acts to extend them again.
Expire. So what happens in 2026 if they just go away?
The impact could be really significant. Premiums would likely go up for pretty much everyone currently getting a subsidy. But the biggest hit would be the return of that subsidy cliff. Anyone with income over 400% of the FPL would suddenly lose all premium tax credits.
Back to paying full price.
Yep. The sources gave a stark example. Think about a 60-year-old couple making maybe $85,000. That's just a bit over the 400% FPL mark. With the enhanced subsidies, maybe they pay, say, $500 a month for their plan after the credit.
Okay.
If those enhancements expire, their monthly premium could easily jump by $1,500 or more. That's potentially over $18,000 extra per year out of their pocket, just from that one legislative change.
$18,000, just like that. Wow, that completely changes the math for early retirement budgeting.
It absolutely does. It injects a huge amount of uncertainty for planning, especially if your retirement timeline crosses that 2025-2026 threshold. You almost need to plan for both scenarios, subsidies continuing or subsidies reverting.
Something definitely to watch closely. Now, besides help with premiums, you mentioned silver plans having something special.
Yes, in addition to premium tax credits, if your income is low enough, generally below 250% of the FPL, and you specifically enroll in a silver plan, you might also qualify for cost-sharing reductions, or CSRs.
Cost-sharing reductions, what do they reduce?
They reduce your actual out-of-pocket costs when you use healthcare. So they lower your deductibles, your copays, and your coinsurance amounts. It's like getting an upgrade on the plan's benefits without paying a higher premium. You only get these CSRs if you choose a silver plan.
So lower income folks on silver plans get help with premiums and help with deductibles and copays.
Correct. It can make silver plans a very attractive option for those who qualify.
Okay, so Marketplace. Guaranteed coverage, lots of plan choices, potentially significant help with costs through subsidies, especially with the current enhanced ones. But those might expire. How do you actually get one of these plans? You mentioned enrollment periods.
Right. Unlike COBRA, which is triggered by losing your job, the main way to get a Marketplace plan is during the annual open enrollment period.
When is that usually?
It typically runs from November 1st through January 15th for coverage that starts the following year. So right now, open enrollment for 2025 coverage would likely be November 1, 2024, Jan 15, 2025.
So you can only sign up or change plans during that specific window each year?
That's the general rule, yes, unless you qualify for Special Enrollment Period, or SEP.
SEP. And does losing your job count?
Yes. Losing job-based health coverage, like when you retire early, is one of the main qualifying life events for a special enrollment period. This is what allows you to enroll in a Marketplace plan outside of that annual open enrollment window.
Okay, thank goodness for that. So you lose your job, that triggers a SEP. How long does that a SEP piece last? Is it like COBRA 60 days?
It's similar, but slightly different timing. Generally, when you lose job coverage, you have a window that starts 60 days before the coverage loss and ends 60 days after the coverage loss.
So a 120-day total window.
To apply for the HESIP and potentially preview plans, yes. But the really crucial deadline is you must select a plan within 60 days after your employer coverage actually ends.
Okay, 60 days after the loss to pick a plan. Now, is this coverage retroactive like COBRA? If I sign up on day 59, does it go back to day 1?
Generally, no. This is a really key difference from COBRA and a potential pitfall. Marketplace coverage usually starts on the first day of the month after you select your plan and pay the first premium.
Uh-oh. So if my job coverage ends July 31st and I pick a Marketplace plan on August 10th?
Your Marketplace coverage would likely start September 1st, meaning you'd have a gap in coverage for the entire month of August.
Oof. Okay, that potential gap is definitely something to plan around. Maybe that's where COBRA comes in handy as a temporary bridge.
Exactly. Some people elect COBRA initially just to cover that gap month, while their ACA plan enrollment processes, using COBRA's retroactivity, and then they drop COBRA once the ACA plan kicks in. It costs for that 1 month, but avoids being uninsured.
Clever. Now, the sources mention another really important rule about SAPs and dropping other coverage.
Yes, this trips people up. You generally do not qualify for a special enrollment period if you voluntarily drop other existing health coverage.
What does that mean? Like, if I'm on COBRA and decide it's too expensive after 5 months, I can't just quit COBRA and trigger a SEP to get onto the Marketplace.
Correct. Voluntarily dropping COBRA before its maximum duration runs out generally does not give you a SEP. Same goes if you had retiree health coverage offered by your employer and you voluntarily drop that.
So you're kind of stuck until the next open enrollment.
Usually, yes, unless another qualifying event happens. However, if your COBRA coverage naturally runs out, meaning you reach the end of your 18 or 36 months, that event does trigger a special enrollment period.
So exhausting COBRA lets you transition to the Marketplace then?
Exactly. But deciding to drop it early because of cost generally doesn't work for triggering a SEP. You have to time things carefully, maybe aligning dropping COBRA with the start of open enrollment if possible.
That distinction is critical.
Okay.
And the sources also mention Medicaid CHI.
Just briefly, that if your income is very low in early retirement, You might qualify for Medicaid or the Children's Health Insurance Program, CHIP. Eligibility for these is usually year-round based on income, so it's another potential low-cost or free option for some.
Good point. Okay, so we've got COBRA, temporary, same plan, pricey, retroactive, and ACA Marketplace. Long-term, until 65, guaranteed issue, plan choice, potentially much cheaper with subsidies, but watch that 2025 cliff,
Yes.
requires a SEP after job loss, usually not retroactive, leading to potential gaps.
That's the core comparison. Which leads us to the big question everyone asks.
Which one is right for me?
And the answer, based on everything we read, is, drumroll, it depends.
Huh. Of course it does.
It truly is a highly personal decision. There's no single right answer that applies to everyone. It boils down to your specific circumstances, your health, your finances, your risk tolerance, your need for continuity versus flexibility.
Okay, let's break down that comparison directly, point by point. Let's start with the biggest factor for many, cost.
Right? Cost. COBRA is generally that fixed high premium up to 102% of the total plan cost. Predictably expensive, you might say.
Yeah, you know what you're getting, and it's usually a big number.
The ACA Marketplace cost, on the other hand, is variable. The sticker price of plans can be high too, but the availability of premium tax credits based on your MGI can dramatically lower that cost.
So the ACA could be much cheaper.
For many early retirees, especially if their income drops significantly after leaving work, yes, the ACA with subsidies can be substantially more affordable than COBRA. But if your retirement income is too high to qualify for subsidies, especially if enhanced subsidies expire, the full-price ACA premium could potentially even be more than COBRA in some cases.
So rule #1 is figure out your likely MAGI in retirement to estimate potential ACA subsidies. That's key for the cost comparison.
Absolutely critical. Okay, next point, coverage and network.
Right. What about the actual plan and doctors?
COBRA gives you continuity. You keep the exact same plan, same network of doctors and hospitals you had. If keeping your specific doctors or leveraging money already paid towards your deductible is paramount, COBRA offers that stability.
No changes, no surprises there.
The ACA Marketplace offers choice and flexibility. You can choose from various plans and networks. This might mean you have to switch doctors if your preferred ones aren't in the network of the plan you choose. But it also lets you pick a plan tier, bronze, silver, gold, platinum, that might better match how you expect to use healthcare.
So, stability versus flexibility and choice. What about expected healthcare usage?
This ties into the cost and plan choice. If you know you have high medical needs or are managing chronic conditions, you need to compare the total potential cost under both scenarios.
Not just the premium.
Right. Premium plus your likely out-of-pocket costs, deductible, co-pays, co-insurance, up to the out-of-pocket maximum. Sometimes, even with COBRA's high premium, if you've already met a large chunk of your deductible for the year on your employer plan, or if that plan has much richer benefits for your specific condition than available ACA plans, COBRA might be cheaper overall for that first partial year.
Interesting calculation.
Conversely, if you're generally healthy and expect low usage, a subsidized ACA plan, maybe even a bronze one, could offer significant savings compared to COBRA.
Okay, analyze your likely total costs based on health needs. What about timing and gaps?
We touched on this. COBRA's retroactivity is a major benefit right after losing your job. Elect it within the window, pay on time, and you have seamless coverage from day one.
No gap risk.
ACA plans via a special enrollment period are generally not retroactive. Coverage usually starts the first of the following month, creating that potential gap if you don't enroll before your old coverage ends. COBRA is the classic way to bridge that specific gap.
So COBRA wins on avoiding the immediate gap. How about duration? How long do you need coverage?
Big difference here. COBRA is temporary. Standard 18 months, potentially extendable to 29 or 36 in those specific disability or second event cases.
Limited time.
The ACA Marketplace, however, can be your long-term solution. You can enroll year after year, potentially with subsidies, all the way until you turn 65 and become eligible for Medicare. If you're retiring at 58, COBRA alone isn't going to cut it. You'll likely need the ACA eventually.
So ACA wins for long-term coverage needs. Lastly, pre-existing conditions.
On this front, both effectively cover you now. COBRA continues the plan you were already on. The ACA Marketplace has that guaranteed issue protection, meaning they must offer you a new plan regardless of your health history. That underlying ACA protection is a crucial safeguard in the individual market.
Okay, so weigh COBRA's continuity and retroactivity against ACA's potential affordability with subsidies, plan choice, and long-term availability. Factor in your health, your finances, your timeline until 65. It's a lot to juggle.
It really is. It requires sitting down and mapping out your specific scenario. And the sources do mention a few other possibilities beyond these two main ones, although they often come with caveats.
Right. What else is potentially out there?
Well, a really good option, if it's available, is joining a spouse's plan. If your spouse is still working and has employer coverage, losing your job coverage usually triggers a special enrollment opportunity for you to get onto their plan.
Oh, yeah. That's often much more affordable than COBRA or even unsubsidized ACA plans.
Definitely worth checking if that's an option.
Yeah.
Then there's buying private insurance directly from an insurer outside the official marketplace.
Can you still do that?
Yes, you can. It might offer different plan options or networks. However, it can often be more expensive, and critically, depending on the type of plan, it might not be ACA compliant, meaning it might not have guaranteed issue or cover pre-existing conditions the same way marketplace plans do. You have to be careful what you're buying.
Okay, buyer beware there. What about those healthcare sharing programs?
The sources mention these as a kind of alternative model. Members, often sharing religious or ethical beliefs, contribute monthly and share healthcare costs among the group.
Sounds different. Is it cheaper?
The monthly amounts can be lower than traditional insurance premiums. However, and this is a big fun, however, the sources strongly caution that these are generally not insurance.
Not insurance. What does that mean?
It means they aren't regulated like insurance. They don't guarantee payment of claims. They often have significant limits on what they'll cover, annual or lifetime caps, and frequently exclude pre-existing conditions entirely or for a long waiting period.
So much riskier.
Potentially, yes. You need to do extremely thorough research and understand you don't have the same consumer protections as with regulated insurance. The sources noted they might be considered by some very healthy, active people, mainly for catastrophic events, but not as a replacement for comprehensive coverage for most.
Okay, tread very carefully there. What about short-term health insurance? That sounds like it could fill a gap.
The sources mention these too, often as a potential temporary bridge, but again with major warnings. Short-term plans are explicitly designed to be temporary fill-ins, and they're typically not ACA compliant.
Meaning
Meaning they usually don't cover essential health benefits like maternity care, mental health, prescription drugs. They very often exclude pre-existing conditions entirely. And their rules, duration limits, and even availability vary wildly by state. Some states ban them or severely restrict them.
So also not a reliable long-term solution, especially if you have health issues.
Definitely not. They're generally discouraged as a primary strategy. Maybe for a very brief known gap if you're young and healthy, but they come with significant risks and limitations. Treat with extreme caution.
Okay, so really, for most early retirees needing comprehensive coverage, it comes back to COBRA and the ACA Marketplace as the main viable paths, maybe with a spouse's plan as a great alternative, if possible.
That seems to be the consensus from the materials, yes.
So, beyond just picking which plan, how can people actually manage the cost of healthcare during these potentially expensive pre-Medicare years? What strategies can help?
Yeah, this is where financial planning really intersects with healthcare planning. One incredibly powerful tool the sources highlight, if you were eligible and contributed while working, is the Health Savings Account, or HSA.
Ah, HSAs. I know they have tax benefits, but how do they help specifically in early retirement?
They have that amazing triple tax advantage, right? Contributions are tax deductible, the money grows tax-free, and withdrawals are tax-free if used for qualified medical expenses. Now, here's the kicker for early retirees. If you retire before you turn 65 and you are not yet enrolled in Medicare, you can use your HSA funds tax-free to pay for health insurance premiums.
Wait, pay the actual monthly premium with tax-free HSA money? I thought you couldn't usually do that.
You generally can't use HSA funds for premiums while you're still working and eligible to contribute. But there's a specific exception for folks who are unemployed, receiving unemployment benefits, or using COBRA, or paying for coverage while not on Medicare before 65. So yes, you can use that tax-advantaged HSA money to pay your COBRA premiums or your ACA Marketplace premiums during this early retirement gap.
That's a game changer, potentially. It makes those high premiums much less painful if they're coming from tax-free dollars.
It can make a huge difference in affordability. And remember, HSA funds roll over year after year. They're yours to keep, even if you change jobs or insurers. And they remain tax-advantaged for medical expenses even after you go on Medicare, though you can't contribute anymore once on Medicare.
So the strategy is max out your HSA while working in a high-deductible plan, let it grow, and then tap into it tax-free for premiums and other costs in early retirement.
That's a very common and effective strategy the sources point to. You can even pay medical bills out of pocket while working, save the receipts, let the HSA compound, and then reimburse yourself tax-free from the HSA years later in retirement. It's like a dedicated, super tax-advantaged healthcare retirement fund.
Wow. Okay, HSAs are key if you have one. What other strategies?
Another approach is what's sometimes called bridge employment.
Meaning,
Maybe you don't fully retire, but you take a part-time job, perhaps something less demanding, specifically to maintain access to that company's employer-sponsored health insurance until you reach 65.
work just enough to get benefits.
Exactly. It provides some income too, but the primary driver is often securing that valuable, often subsidized health coverage during the gap years.
Makes sense. And ultimately, whether it's COBRA or ACA, the money for premiums and deductibles has to come from somewhere, right? It needs to be in the retirement budget.
Absolutely. You have to factor healthcare costs, potentially significant ones, into your overall retirement spending plan and your withdrawal strategy from your savings, like your IRAs, 401ks, or taxable accounts.
Which leads us to a really interesting and potentially tricky interaction the sources brought up, Roth conversions and ACA subsidies. This sounds like a potential landmine.
It definitely can be if you're not aware of it. It's a more advanced planning point, but crucial for some early retirees.
Okay, quickly remind us, what's a Roth conversion?
It's when you move money from a traditional pre-tax retirement account, like a traditional IRA or 401k, into a post-tax Roth IRA. You have to pay ordinary income tax on the amount you convert in the year you do the conversion.
Pay tax now.
So that later on, all the qualified withdrawals from that Roth IRA in retirement are completely tax-free. Many early retirees consider this because their income might be lower before Social Security or RMDs kick in, putting them in a potentially lower tax bracket to do the conversion.
Okay, sounds good. Tax diversification, tax-free income later. How does this possibly mess up your ACA subsidies?
Remember how we said ACA premium subsidies are based on your MGI for the year?
Yeah, oh no.
Exactly. The amount you convert from a traditional account to a Roth, that converted amount counts as taxable income in the year of the conversion. And therefore, it gets added right into your MGI calculation for that year.
So doing a big Roth conversion could artificially inflate your MGI just for that 1 year.
Precisely.
Yeah.
And if that artificially high MGI pushes you over the income limit for subsidies or significantly reduces the amount of subsidy you qualify for, you could see your health insurance premium costs skyrocket for that specific year.
Yikes. So you're trying to save on future taxes with the Roth conversion, but it could cost you thousands in lost health insurance subsidies right now. That's a nasty trade-off.
And it's a very real conflict and requires careful balancing. You might be saving on taxes long-term, but facing a huge immediate increase in healthcare costs.
So what's the strategy then? Just don't do Roth conversions if you need ACA subsidies?
Not necessarily. A common strategy discussed is to manage the amount of the conversion each year. Instead of doing one huge conversion, maybe you spread it out, converting smaller amounts over several years.
Keep the annual conversion low enough to stay under the subsidy thresholds, or at least minimize the impact.
Exactly. You carefully calculate how much you can convert each year without bumping your MDI up too high and torpedoing your subsidies. It requires careful planning, potentially with a financial advisor who understands this interplay, to optimize both your tax strategy and your healthcare affordability.
Wow. It just underscores how interconnected all these financial pieces are in retirement. Which brings us back to a point you made earlier. This is not something to figure out the week before you give notice.
Absolutely not. The sources universally scream, plan ahead. Start researching these options, estimating costs, and figuring out how health insurance fits into your retirement budget, ideally 1 to 2 years before your planned retirement date.
A year or two out. Why so early?
It gives you crucial time to get a realistic estimate of your retirement income, which is vital for ACA subsidy calculations. Time to research the specific COBRA costs versus the ACA plans and networks available in your specific area. Time to understand the enrollment rules and deadlines. Time to potentially build up HSA funds if you can. Time to adjust your savings or even your retirement date if the healthcare costs look unmanageable.
Makes sense. Avoid last-minute panic.
Totally. The sources even suggest milestones. 24 months out, start the high-level research. 12 months out, really start crunching your numbers, estimate MEI, maybe talk to an advisor. 6 months out, aim to finalize your decision. Know the exact enrollment steps, get paperwork ready.
That structured approach makes it feel much more doable. And we should also quickly mention the plans and costs can really vary depending on where you live, right?
Oh, absolutely. State variations are huge. Some states run their own ACA Marketplace websites. Others use the federalhealthcare.gov. The insurance companies participating, the specific plans they offer, the provider networks, and the actual premium costs can differ significantly from state to state. If you're planning to move when you retire, you need to research the options in your new state.
Good point. Okay, so the big messages are plan early, understand COBRA and ACA inside out, know the costs based on your income, watch those deadlines and SEA rules, factor it all into your budget, and be aware of how things like Roth conversions can impact subsidies. Phew, it's
Yes.
complex. It feels like navigating this maze could be really overwhelming for someone on their own.
It definitely can feel that way, which is why the sources also talk about the different ways you can actually get help understanding your options and enrolling, particularly for the ACA Marketplace. You don't necessarily have to go it alone.
Okay, so what are the main ways to get help or guidance?
One common route is working with an insurance broker. These are licensed professionals, and the key thing is they typically work with multiple different insurance companies.
So they can compare plans from different insurers.
Exactly. That's the big advantage. A good broker can assess your situation, explain the options from several carriers, help you compare costs and networks, figure out subsidies, and assist with the whole enrollment process.
Does it cost money to use a broker?
Usually, no, not directly to you. Brokers are typically compensated by the insurance company whose plan you end up choosing. A potential concern is whether that creates bias. But many reputable brokers focus on finding the best fit for you. Some sources even mention seeking out brokers whose compensation structure minimizes bias towards any specific plan.
Okay, so brokers offer broad comparison and expertise. What about a captive agent?
A captive agent is different because they work exclusively for one single insurance company. Think State Farm or Allstate agents, for example, though often specializing in health.
So they only sell plans from their one company.
Correct. The pro is they likely know the company's plans inside and out and can make enrollment smooth. The obvious con is they can't offer you plans from any other competitors. Your choices are limited to that one insurer, which might not have the best or most affordable option for you compared to the wider market.
Limited choice there. And the third option.
Self-enrolling, just doing it all yourself, going directly to healthcare.gov or your state's marketplace website, researching, comparing, and enrolling online.
Taking control. What are the pros and cons there?
Pro is complete independence. You research at your own pace. The con is, well, everything we've just talked about. The complexity, understanding subsidies, comparing nuanced plan benefits and networks, making sure you don't miss deadlines or make costly mistakes. It's doable, but there's definitely a risk of choosing a suboptimal plan if you're not well-versed in it.
So, given the stakes securing affordable health coverage for potentially years, what's the takeaway on getting professional help?
The sources strongly suggest that for many people facing this transition, particularly into early retirement, getting guidance from a qualified, licensed health insurance professional is highly valuable, especially someone experienced with early retirees and the ACA Marketplace,
Why, especially them?
because they can help you navigate all those complexities we discussed. Accurately estimating MGI for subsidies, comparing total costs across different tiers and plans in your local area, ensuring your doctors are in-network, understanding the SEP rules, avoiding gaps, and even thinking about how the choice integrates with your overall retirement income plan. They bring that expert perspective to a really critical and often confusing decision.
It sounds like getting help isn't just about convenience. It's about making a potentially much better financial and health decision, protecting both your health and, frankly, your retirement savings.
Exactly. Healthcare is one of the biggest potential wildcards in any retirement budget. Getting the insurance piece right is fundamental to protecting the financial freedom you work so hard for.
Okay, so wrapping up this deep dive then. For early retirees needing health insurance before Medicare at 65, the journey primarily involves understanding and choosing between two main options: COBRA continuation coverage
Keeping your old plan temporarily, usually at high cost.
and plans bought through the ACA Health Insurance Marketplace,
Guaranteed coverage, plan choice, potential subsidies, long-term solution.
and deciding which path is best, or maybe using COBRA as a short bridge to the ACA, is deeply personal. It hinges on your health, your finances, your retirement income projections, and really digging into the specific rules, costs, and timelines for each.
Absolutely. And the number one takeaway, repeated across all the sources, is the critical importance of planning early. Don't wait until the last minute. Start exploring 1-2 years before retirement. Understand the real costs based on your likely income. Know those enrollment deadlines and special enrollment period rules cold. And make sure this huge piece fits into your overall financial strategy, including how things like drawing retirement income or doing Roth conversions might affect those potentially crucial ACA subsidies.
It's definitely a puzzle with a lot of moving parts, but it seems like with that advanced planning, careful comparison, and maybe getting some expert guidance, you can find a way to secure coverage and protect that hard-won financial freedom.
You can navigate it. It just takes proactive effort.
Which kind of leaves us with a final thought to chew on. We've talked a lot about the current landscape, COBRA, the ACA, those enhanced subsidies, but healthcare costs keep rising, and the future of things like those enhanced subsidies beyond 2025 is uncertain. Planning for early retirement health insurance isn't just about making the right choice today. It seems like it also has to be about building in flexibility and staying informed for the long haul. So the question for you is, how will you ensure your healthcare strategy remains adaptable and affordable throughout your entire retirement journey, whatever changes may come? Something to definitely think about as you take the next step in your own planning.
A vital question indeed. Constant vigilance and adaptability are key.